right, this is Pamela Worth with the Hello Health Podcast. Today I have Dr. Diana. She's been practicing naturopathic medicine and traditional Chinese medicine on Oahu since 1989. She has a wide variety of experiences and has lived in a number of different places in the world and really brings together this holistic view in a really awesome way. So, welcome, Doctor.
Thank you, Pamela.
So, you, we were talking a little bit before we started here. You've got this practice where you take care of a number of different types of people in age and um, wellness, and obviously there's a lot of talk around social media and how it's shaping children right now. Um, Tell me a little bit about what your experience is with this.
Okay, so work with primarily women, and most women have children, teens, families. There, and what I'm seeing is there's a big relationship between how our emotions, what's going on emotionally in our life, and our health. And typically, women of, I'll just say my age, I'm in my 60s now. We've been taking care of the kids, we've been taking care of the teens, we've been taking care of our husbands, our families, our jobs, our work, our home, everything, and neglecting ourselves. And we get to a certain point in time where we look at ourselves in the mirror and say, "Oh my God, how did this happen to me? Now I feel old, I feel tired, I'm exhausted. I lost my motivation, I've lost my libido, I've lost my energy." And they realize that it's that everything has taken a toll and they've allowed it to. When women are have lots of hormones circulating in their body, especially estrogen, they are really family oriented. They're in this mental state of giving and doing for others. We want to prepare meals. We want to take care, make sure everybody's got their lunch packed. I just remember that really clearly when I was raising kids, even though I didn't have my children till I was 40. I was very, very happy to just take care of them. It was all about them. And then it's kind of simultaneously to when my hormones started to decline, my interest in cooking just started to decline, and I was less attached to the what was going on with everybody else because I was realizing, wow, I got to take care of me too. So it's not uncommon for us to get to this point, but up until then, our emotions are affecting us in such a deep way, and what's going on with our children is affecting us. I read an article this morning that was heartbreaking, but such a reality in our modern society about how social media, influencers, marketers, and the uh, the what is it called when the it's social media knows what we're interested in. I lost the word. The algorithms, how these things are shaping our children, but not only shaping what they watch, they're deliberately, without consciousness, I mean, without conscience, they're deliberately taking the child away from the attachment to the family bond, and they're helping that child to feel more isolated. So they need the social media in order to feel recognized, to feel loved, to feel seen. And this is a crime against our children. And it's happening on such a subtle but such a profound level that we as parents need to be aware of it. And all that I can derive from understanding that, in addition to how children are now exposed to more street drugs with the addition of fentanyl. And I don't know about you, but I know for a fact that the quality of the weed, the marijuana that we smoked in not in the 70s compared to what their kids are being exposed to now is night and day. It's more harmful to the brain. It's creating set levels of anxiety, not to mention the vaping. And of course, our the parents seeing the kids going down this road of vaping and having anxiety and being on social media and getting depressed and comparing themselves to everyone else online. This is so sad and so detrimental. And so, as parents and women, our job, being that the woman of the house, has to be the one to hold everything together, the glue in the family. The family bond needs to be so strong so that children know to come to their parents for love, for encouragement, for feeling seen, for being understood. And I see it all the time. Parents are distracted with the cell phone and the social media and the Facebook, and of course, the kids see that. And the other thing that now the social media is being used, or the devices are being used as babysitters. I mean, this is nothing new, but I see it all the time. The kid's making noise when he shouldn't even be in the dentist's office or like in the doctor's office with me, perhaps. We have toys. So when they bring their kids, we give them toys and Legos and puzzles and books. But a lot of people just give them the phone. And when a kid is exposed to that electromagnetic energy and the stimulation of that, it changes their brain immediately, creating more anxiety, more need for dopamine, more need for the stimulation. And I am just praying that parents will realize how much their role modeling, how important it is, and how this attitude of being busy and being preoccupied and distracted. I think there should be rules. No phones at dinner, no phones on Sunday, phones off at a certain time, no phones in the bedroom. Like a phone should be used to call your friends or to call people and limited. And I just really see it, amongst my patients with autism and ADHD. There's just an obsession with the electronics, and I really think it's up to us as parents to see that and to take an active role in making sure our kids feel safe at home, feel loved, and feel empowered, and are encouraged to do other things that use their brain in different ways than seeing what's the latest hype is on the media.
Right. So, how are you approaching some of these ways of detox with families in terms of whether it's electromagnetic, whether it's chemicals, whether it's so? What are some of the things that you like to help your patients with when it comes to cortisol levels, relaxation, ways of other types of detox?
Good question. So I'm no different than everyone else. When a patient comes to see me, their energy field affects my energy field. And I've worked very hard over the last decades to get my energy in such a state that I'm at peace. And when I'm sitting with a patient, I need to be at peace so that I can help transfer that peaceful energy. If a patient comes in stressed out, the first thing I do is I say, okay, we're going to just start with meditation. And I have them close their eyes, turn off the phone, close their eyes, and breathe. And I run them through, it's sort of like a hypnotherapy session where I just help them bring the relaxation. And then I say to them, okay, I'm going to give you 5 minutes. When I come back in 5 minutes, I want to see you in the exact same position because I want to train them to be able to do it when I'm not there. And, there are times where I come back and the patient's on their phone. And then there are other times as the more often that we do it, that they come back and they're so at peace And I say to them, how do you feel? And they say, oh my God, I feel so relaxed. And so, with almost every single one of my patients that shows up with hyperactivity or the ADHD or nervousness, I do that technique. And not only does it help them, it helps me because I can be with them in such a more effective way if they're not spinning out. Because as you know, and probably most of the people that you're speaking with know, maybe you don't. When our cortisol is running through our system, which for many people is 24/7, even during their dream state, healing cannot happen. Our bodies do not heal when we're stressed, period. So I don't care whether we're working on hormones or gut health or ADHD or anxiety, the body cannot heal. So that's partly why I do acupuncture treatments. When how I train myself to be still and relax is I would put acupuncture needles in myself and I'd lay there and it's like a forced relaxation. I've got these needles in me and I didn't want to be there. I would be thinking, this is dumb. I am too busy. I can't take a nap in the middle of the day. It was so hard for me. But I forced myself, I trained myself to lay there for 20 minutes. Now it's a daily thing. Every single day when I take my nap, I put acupuncture needles in, I lay there and relax. But we can do it just as easily without acupuncture needles. We just need to train ourselves. For 20 minutes, I am going to sit here or lay here and breathe. And it's perhaps the most important thing we need to train ourselves as parents to do, and we need our children to see us. Another technique that I often teach teachers who are patients or just parents with young kids, I say, okay, the next time your kids are acting out, go sit, close your eyes, and meditate and let them see you. And before you know it, they'll be doing this. They'll be like, what's mommy doing? Like, and they'll quiet down and they'll be curious and they'll probably copy you because that's kind of how the Waldorf teaching is. They don't tell the kids, okay, now we're going to get up and take our dishes and wash them. The teacher starts to do it and the kids follow. And it's like we are the role models. We adults are shaping the kids. So we need to be really smart with how we do it.
What are some of the other ways that you like to help people when it comes to nutrition, when it comes to diet?
Mhm.
Some of the
Okay.
things that you like to share.
Well, when it comes to diet, the first thing that I often encourage people to do is to actually keep a record of what they're eating and then bring it and let's evaluate it. And sometimes they don't realize how much bread they're eating or sugar or whatever, and we review it together. And then because I'm an expert in nutrition, I've read every book and I had 2,000 hours of clinical nutrition in naturopathic medicine school. So either will, depending on the severity of their illness, if they have cancer or a real debilitating disease, or I give them the option. I say, do you want to heal fast? Do you want to do this quickly? Or do you want to take your time? Because in my reality, it's like if you make a 2% change in a week, you can change your whole life in a year. And so I give them the option. I say, if you want to go slow, maybe let's cut out these few foods, maybe reduce the sugar, maybe instead of two cookies, have one, maybe instead of two pieces of bread, have one. And I have them do it more gradual. Now, if they have cancer or a chronic degenerative disease and they're urgent, I say, cut cut the pork, cut the sweets. Certain foods are debilitating for their body. So I'll just tell them, but everyone is a little different. So we have to gear the diet toward what that patient needs. I also run them through detoxification programs because our liver, there are four areas that need detox. Our liver, our lymph, our blood, our cells, and our colon, not five areas, but our colon And our alimentary canal contains the largest part of our gut microbiome. We have to get our microbiome balanced before we can detox the pathogens out of the gut. We have to clear the blood, clean out the blood. We do that with ozone treatment and IV nutrition. And we far infrared sauna, massage. And the liver needs to be detoxed in a very detailed and specific way because there are 694 functions that the liver needs to take care of every day. So we think as women, we're busy, the liver's way busier. 694 functions per day that include making energy out of our food, detoxifying everything that goes in and on our body, breaking our hormones down into usable aspect. So the hormones are going to run through the liver. So the liver has so many jobs and it's essential. And if we want to lose weight, metabolism is huge part of liver function. We have to be able to clear the liver. The liver must be cleared, the liver detox pathways in order to lose weight. Why? Because the body stores toxins in the fat cells. And if the liver is clogged, then the body is intelligent enough to know that you can't mobilize that fat that's full of toxins because the detox pathways are blocked. So we must detoxify the liver if we want to lose weight. So that's step number one. Additionally, we need to clear the lymph. Most doctors don't even think about clearing the lymph. I've created my whole line of remedies, natural medicine, to clear the lymph. In the head, people should not be using Sudafed and those over-the-counter things that open up the sinuses because they are stimulants and they're addictive. So, but we need to be able to clear the lymphatic system, especially in our head, our sinuses, in our throat, in our body. The lymphatic system parallels the blood vessels head to toe. And if it's clogged, toxins cannot escape. So these are all the different areas that need to be taken into consideration, even before we, like I said, lose weight, or before we can breathe clearly, or before we can really make headway in our health. And that's why health takes time. I usually ask for a minimum of 3 months for a patient so that they can see remarkable and substantial changes in the body. But I'm fortunate enough to know what to do in step one, and most patients feel so much better by week two. It's dramatic just by the small changes that we make.
Yeah, no, that's fabulous. So when you're talking to someone about the detox process to get them ready for healing from whatever they're going through, and you talked about each one of these five areas of the body that you like to focus on. Do you hit them all at once? Do you hit them in stages? What does that look like?
Say that again. What's the question?
Do you hit all the detox of the areas of the body at the same time, or do you do them in a certain?
Oh, no, we'll usually start with gut
Mhm.
because the gut is something they will see immediately. The bloating clears, the bowel movements are better, the cravings are better. They're not eating incessantly for no reason. Like there's real clear, substantial progress in the gut. The sinuses are pretty substantial too. Patients love these lymphatic clearing remedies. They really work wonders.
So, what's an example of a lymphatic clearing remedy? Like, what is
Uh,
that?
Well, like for instance, Hoxie formula clears the lymph. There's a variety of traditional Chinese medicine formulations that I have created with uh, one of my colleagues, and we made our own formulas that contain a variety of Chinese medicines that help to clear the lymphatic system. Chrysanthemum. I would have to take the label and read it to give you the specific herbs because there's so many different ones that we use. I'll send you a bottle. You'll love it. And you let me know which area you want to work on. We can clear either the sinuses or throat or the lungs. The different areas have different specific herbs that combinations typically work well.
And do you see, is there one or two or three major things that you're seeing in your patients lately that you're really,
I'm seeing a ton of cancer, sadly.
uh
Of cancer. And nowadays, even people in their 30s and 40s are coming in with cancer. So that's heartbreaking. We do have great protocols here to help them. And I often encourage someone to come for three weeks to 3 months if they can make it. And we go through the process of clearing, and we're seeing their cancer markers. We had a lady that went from 6,000 cancer markers all the way down to 10 in 4 months. So we're seeing dramatic changes there. Everybody's got gut issues. The main ones: gut, hormones, energy, brain fog. Those are the basics. But typically I'll ask them just list, and I'll get a list of like 10, 20 symptoms sometimes people have. And the great thing about naturopathic medicine, or at least the way I work, is that I do address all of it. Whereas some doctors, I once went to a doctor, I said, my knee hurts. And she looked at my knee and wrote a prescription. And I said, yeah, I think it's coming from the ankle. Would you check my ankle? She said, no, you'll have to make another appointment for that. And this is after I waited 45 minutes. So we don't do that. We address all the concerns because the body is connected. And what's going on with the head is affecting the heart and the stomach. And the other thing that women are forgetting, or maybe don't realize, is how our hormonal changes are affecting our heart. And the number one risk to women is heart cardiovascular. So we have to be noticing that when people are having hot flashes, that can be a sign that we need to correct the cardiovascular health, and we need to protect it.
and how does someone protect their cardiovascular? Is it just doing exercise or is there something else that you recommend or?
Well, a lot of different avenues. So blood cleansing to make sure that the blood is not, you know, filled with fat and cholesterol and plaque, that it's flowing smoothly. But hormones. So when women stop producing estrogen, which is cardioprotective, there's more chance that they could have problems with their heart. So I don't know if you heard about the new awareness that came out, I think with Robert F. Kennedy, is they're realizing that for decades doctors were scaring women, saying that estrogen was a risk to be using estrogen. And I think it had to do with they were using like horse urine, or they were using like a not a good kind of estrogen, a chemical based one. But now we're realizing we've been using bioidentical hormones for decades. And these bioidentical hormones, they mimic what the body would produce. So they're very safe. And when used properly and properly prescribed by someone like me, they can protect your heart, your bones, your brain, your skin, your libido, all the areas that seem to go into decline when we hit 45 or 50.
Fabulous. Any last pieces of wisdom and advice you want to impart before we?
Well, for advice, I think it's really important that people not ignore what their body is telling them. And the symptoms are warning signs. And if our body didn't create symptoms, we would have no way of knowing there's something wrong. So if you have a pain in your belly, or if you have a headaches, a chronic headache is not an ibuprofen deficiency. A chronic headache may indicate that there is some liver problem, because the head corresponds to the liver. So pay attention to the signs. If you're starting to get arthritis, pay attention, because there are things that we can do to eradicate these problems if we start right away before it's not just aging. There's things that we can do. Like even if we look at the genetic profile, there are things we can do nutritionally to correct imbalances, even in our genetic profile. So I highly recommend that every person out there work with a naturopathic doctor. If you don't have one, you can contact my office and we can start the process of correcting your body and getting you to a place that feels good. If you're not feeling good in your body, there's a sign that something needs to change.
No, that's absolutely true. Thank you so much, doctor. And I'll be sure to put your contact information in the show notes. And I really appreciate you being on today.
Thank you so much, Pamela.